Hey, Dr. Josh Wagner here with Patient Mastery. Thank you for joining and watching. In this video, I'm going to share with you the single greatest self-sabotage chiropractors do in practice to crush new patient retention, referrals, and investment. And that is chiropractors believing that patients have to understand and agree with what you do, what chiropractic is, in order to accept care, stay with you, and refer other people. So let's take a look at this. If you were to go to a PT, physical therapist, or an orthopedist, or someone you knew were going to go for an injury, for a condition that they were looking to get resolved, and it doesn't just have to be a PT or an orthopedist, it could be a pediatrician, it could be a dentist, it could be an oncologist. Think about getting your care recommendations. Think about going through the exam. At what point is the PT or the orthopedist educating you, convincing, trying to get you to agree with what they're doing, how they see the body, or the methodology and approach that they're going to do for treatment? It doesn't happen. It's just assumed. This is what we're going to do so you get better. Now, what are you looking for as the patient? You're looking for certainty, trust, and leadership. When you, as the chiropractor, and I know this isn't your fault, you've been taught to do this by practice management or coaches at the same time that insurance came about in the field as a way to maximize insurance benefit, you've been taught that patients have to agree and understand what you do. But you know what happens? That actually pushes people farther away. It causes them to be skeptical because patients didn't come in for a lesson, to get an education, to change their paradigm on health. Now, that could happen through a course of care, through actually proving what you do works and educating through the process. But when someone comes into you, a new patient, 99% of the time, they're in pain or they're stressed because of a condition. That's why they're coming to you, even if you have a wellness practice. Less than 1% of your new patients are wellness patients. So in that state, they're nervous, they're hesitant, they're fearful, they're especially skeptical because of the reputation chiropractic has. And in that state, they're in a sympathetic psychological state. They literally can't interpret, digest, hear logical education or information when they are in a stressed, sympathetic state. And the more you do try to educate, convince, get them to agree on what you do, the more it comes off like you're selling, like you're trying to convince. And the only reason someone tries to convince someone else is because of an inner insecurity. So you're actually coming off with that energy. And patients can pick that up. So the more you think someone has to agree with and understand why you're doing what you're doing, your care, your philosophy, your recommendations, your treatment plan, whatever it may be, the more you're actually sabotaging your trust, your credibility, your leadership, and your certainty. And those components are what patients are actually attracted to, actually influenced to invest in. Now, as long as you're having clinical certainty, you're honest, you're being true to yourself and them and your recommendations, as long as that's a platform and a foundation for everything you're doing, you don't have to educate 90% of what you've been taught you need to do. Now, it doesn't mean there's no room for education. You can bring that about through the process of care. Patients can't hear your education before their symptoms go down anyway. One, because they're in the sympathetic state. Two, you haven't shown them any reason to trust you. So once their symptoms start to subside, one, you've gained trust and leadership because what you said is actually happening. And two, they're getting out of their stress ideology, consciousness, and into parasympathetic so they can actually digest and understand whatever it is you do want to teach them. So to wrap up, the more you are trying to educate patients to agree with and understand what you do in any capacity, the more you're pushing them away, causing them to be more skeptical, less likely to invest out of pocket, stay with you, or refer others. The less you do of that, and the more you bring in the mentalities, the energies, the new patient experience, the 6-question consult, the 5-minute recommendations conversation that I teach at live trainings in the masterclass, the more you will see your retention, profitability, referrals, ease, and fun in practice dramatically increase and wonder, I wish someone had told me this 20 years ago. That's what I hear from chiropractors every day who start using this material. So let go of what doesn't work, get past the self-sabotage that affects so many chiropractors, and have the practice that you deserve, helping a lot more people. Thank you for all you do.